Well, Tennesseans will soon get a chance to weigh in on a dramatic health care proposal from Governor Bill Lee's administration.
The first draft of a plan affecting potentially 1.4 million enrollees in the state's Medicaid program, TennCare, was released today. New at 5 State Capitol reporter Chris Bungard now takes a closer look at the proposal.
State lawmakers earlier this year passed a bill requiring Governor Bill Lee to seek what's called the TennCare Block Grant. After a ribbon cutting in Nashville Tuesday, Governor Bill Lee spoke about the first draft just released of getting billions for the state's Medicaid program TennCare in one lump sum yearly from the federal government instead of a nearly 2-to-1 match system that every other state uses. The coverage of 1.4 million Tennesseans is at stake, along with potential savings for the state budget.
They could be a small amount or a significant amount. And once we determine what that amount is, then we'll decide, well, then that will help us set policy going forward.
3 mid-afternoon times in 3 parts of the state have been put aside for public input beginning October 1st.
We believe we put together a really good proposal that's going to be a win for Tennessee and a win for the country if we get an opportunity to lead on this.
A group advocating for TennCare enrollees doesn't see it that way for the first of its kind proposal.
What it means for the 1.4 million Tennesseans that are on TennCare is that we're going to have less funds to basically have their vital health care needs met.
Michelle Johnson will be one of the voices heard at those October public hearings.
If it really is that great of a deal, I just wonder, why is it that no other governor's lining up to take all this money?
No doubt there will be a lot of discussion and debate about the TennCare block grant bill before the final draft is submitted to the federal government on November 20th. Reporting from the state capitol, Chris Bungard.
Now, just last night, I sat down with our State House Speaker Cameron Sexton on block grants and affordable health care. Here's what he had to say about this issue.
The TennCare block grant is one opportunity to give us more control where maybe we can provide more additional health coverage out there or enhance services already and help providers as well. So that's one answer to that. What we have is a system where the insurance company is the one who dominates everything. They're the ones who are telling the providers what to do. They're the ones who are making it so complex you can't shop the price. And people want accessible, affordable, quality health care, and we're all on the same page. It's about how do you get to that point. But part of it is you can't have affordable health care if the consumer doesn't know how much something costs. That's fundamental to any kind of free market approach.
Now, Sexton also shared his priorities going forward as he takes his seat as state speaker. Make sure to join us this Sunday at 12:30 for more of that interview and much more on Tennessee This Week.